Hi, my name is Elyn Jacobs, and I'm going to share with you my breast cancer diagnosis story. Okay, so my diagnosis story. In December of 2006, I had what I expected to be a routine mammogram, and I get the phone call from them saying, "Oh, we need you to come back in for more films." So, of course, this my kind of thought process was, well, what'd you do? Did you forget to do something? Did you lose my results? What happened? So, no, we just need you to come back in for some more, some more tests. So I do. And of course, the nurse says to me, the doctor would like to see you in his office, which is never a good thing. So I go in there and he's got my breasts all over the walls and his office on these screens, and he says, okay, so these things here are called calcifications, and 30% of the time they're nothing to worry about, and 30% of the time they're precancerous, and 30% of the time they're breast cancer. And then he looked at me and he said, I've seen enough of these over my life. I think you're in the latter 30%. So I think you need to go for a biopsy right away. And then he said he could not do the biopsy because my particular case was very difficult, and he only knew of one person who could really do a biopsy. So anyway, my phone was ringing before I even walked in the door, which is about 3 minutes from the radiologist. And it was my OBGYN who assured me everything was going to be fine. One way or another, I would make it through this, which is a great phone call to get at that time in your life. So anyway, I go for the biopsy, and that was quite an interesting experience, but wonderful, wonderful doctor. And she tells me that I'm going to hear from her within 24 hours. And I said, sure, I'm sure I will. 23 hours later, there she is calling me to tell me that it's stage 1 invasive breast cancer. She recommended a few surgeons, and she said, you need to take care of this right away. And I thought, well, that's pretty pushy. It's probably been growing in me for a long time. But her reasoning was she didn't want me dwelling on it. She said, just move on with your life. Go get this taken care of and move on, which I thought was fantastic advice. Not rushing me into making a decision, just saying, don't sit on this. Just get past your cancer. So anyway, I went back to my OBGYN for some more advice, called him up, and he agreed that her 2 surgeons were probably the best in New York for my situation. So she had told me to call him right away, and I did, and I made 2 appointments. And that's really the end of the diagnosis, but the important thing to know is when you get that diagnosis, to keep a level head, and that's what my OBGYN tried to get me to do.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.